Every 34 seconds, someone in the United States dies of cardiovascular disease, and every 3 minutes, someone dies of a stroke. On today's All Things Heart, the tie between heart disease and strokes. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. We know that high blood pressure, high cholesterol, and smoking are 3 key risk factors to developing heart disease. But what about genetics? The man you're about to meet has a long family history of heart problems, and now after getting hit with his own health crisis, he's fighting back.
I just put those up last weekend. I got plans. These trees are going to come down. I built that wall and put all this here, put the rock down.
Richard Purvis is back to being busy.
I'm always out here doing something.
And he plans to stay busy the rest of his life.
The way I look at it, if you don't stay busy, people retire and they just sit around and do nothing. Well, next thing you know, they pass away from pretty much doing nothing. Made that kind of look like a little river.
Richard is acutely aware of how fragile life can be. He says his grandpa died of a stroke at 47. His dad died of a heart attack at 47. And his brothers?
My oldest brother had a serious heart attack at work, and my youngest brother had a heart attack at home. And then I have another brother, he had a stroke.
But Richard's first brush with death happened at 31.
And it felt like I pulled a chest muscle at first. So I went to the doctor, and that's when they found out I had a blocked artery, 95%.
Diagnosed with heart disease, Richard underwent bypass surgery. 10 years later, he needed a second surgery for another blockage. By the time he turned 65, he thought he was out of the woods. He was very wrong. On October 1st, 2024, Richard was working his shift loading furniture onto trucks at the store where he works.
I was helping loading out of the van, and then I just stopped. As soon as I couldn't speak, I knew I was having a stroke.
Luckily, his co-workers recognized the signs and called 911. Next thing he knew, Richard was in an ambulance racing to the nearest hospital. That hospital moved him quickly along to the University of Kansas Health System, where neurointerventional surgeon Dr. Michael Abraham removed a large clot that had traveled from Richard's heart to his brain. It's something Dr. Abraham says is very common. A terrifying course of events, but just a few weeks later,
all my limbs and everything are working just fine. I'm talking fine. So all this is grass. I dug it all up and put a drainage in there. And
Richard is continuing his full life with a renewed mission, making sure every male he knows stays on top of their health, family history or not.
It's unreal to me that men don't go to doctors. If people are having these problems, they need to have it checked. I mean, it's no joke. It can kill you in a heartbeat.
Joining us in our studio today, we have Richard Purvis. Richard, I need some work done at my house. Come over and do some things. You must be amazing to live with. We also are joined by electrophysiologist, cardiologist, Dr. Madhu Reddy, and neurointerventional surgeon, Dr. Michael Abraham. Thank you so much for making time to be here, doctors. Richard, how are you feeling today?
I feel great. Feel pretty much normal. I mean, when I come out of the surgery room, I'm like, why am I talking? Because I knew when my brother had his stroke, it was a major stroke, and there was no talking. His brain didn't work. All that kind of stuff like that comes with it. So I'm like, it don't make sense to me. But there I was talking.
Your wife says she was not expecting you to be talking full sentences. And did you call her on the phone, or she had stepped out to run an errand?
Did I call you? Yeah, I probably did.
And she said, you said, hey, I'm fine, or something. I mean, no one expected that. And thank God that's how it turned out. With so many men in your family having heart problems, did you have a primary care doctor or a cardiologist already that you were set up with?
Well, I go to the VA.
Okay.
And at this time, they didn't have a cardiologist. So I hadn't seen one probably year and a half, maybe 2 years at the most. So, you know, I didn't know all this was going on. Actually, I mean, you know, and then it just hit me, you know, and I'm like, I knew what was going on because I've been around people, you know, my brother had a stroke, so I knew what was going on.
Well, thank you for your service.
Yeah, thank you.
And,
so I knew exactly what was going on, and the people I work with got on it right away, and I work right across the street from a hospital, so they were there like a matter of minutes, and then transferred me here to KU. And then Dr. Abrams went in and took
pulled
care
the
of me.
thing out.
Took care of me, yeah.
And we're going to show another picture of what you pulled out of Richard's brain, which is so wild to see. Thank God you stayed late to work too that day, because you had stayed to do a favor for someone. Yeah,
they was loading out a truck, the last truck of my shift, and I thought, well, I'll just stay and help them out and get it done, and then I'll go home, you know. Well, thank God I did stay, because I would have been in my vehicle on the way home, and God knows what happened, because I crossed right over I-35 coming off of 75th Street. I mean, I could have ran off the bridge or anything.
Things happen.
You know, so, you know, I'm pretty lucky there. All the things that I've had in my life happen, there's been somebody there, and that's pretty lucky if you ask me.
You bought any lottery tickets?
No, but I should.
You definitely should. I think you should. Dr. Reddy, Richard was 31 years old when he had his first heart scare. His artery was blocked 95%. How does that happen so young?
Genetics plays a big role. I mean, it's a big role. We talk about, most of the times, cardiologists, we talk about things that we can prevent, that we can modify. So we talk about high cholesterol, diabetes, you know, smoking and things like that. But one of the top 5 risk factors are genetics. And we don't know how to modify that. Of course we can't, because we are who we are. And that is probably one of the least modifiable, and in fact, it exists and happens. It happens in, actually, I have a strong family history of heart disease too. My dad died at 50 of heart attack too. So it runs in the family, and you can't modify that. So that's one of the reasons why you have what you have. It may be a combination of not just genes to have heart disease, but genes to have more cholesterol, genes to have other things that contribute to heart disease. So it's a combination of everything. And you have it, when you talk about lottery ticket, that's the bad lottery ticket that we have.
I'm so sorry, your dad was 51, that's so young.
Yeah,
50?
50.
Is that why you became a cardiologist?
Yes. He died of heart disease, he had a heart attack and ventricular tachycardia, so that's what I specialize in. And the day we lost him, I decided to be a cardiologist.
Wow.
So,
But your dad's guiding you. Every time you come to work, your dad's looking down from above. So proud of you. Do you see most of your patients have some sort of genetic history?
I would say about 40% of them have genetic history to contribute to heart disease. I mean, it's very common. We don't talk about it as much as we should, because we don't have anything to modify that. I think the thing that we modify is that if you have genetics like that, we should be more aggressive early on to prevent, to screen, to see a doctor on a regular basis. Most of the guidelines are for populations where they look at the other risk factors, and based on that, okay, if you are 45 and above, you need to get your cholesterol done, but checked. But if you have a family history, probably it should be at 25 or 20 when we should be checking the cholesterol, getting treated for that. I don't think we do as good a job with genetics as we should be doing.
Right. We're going to get to Dr. Abraham in a second to show more about what you actually removed from Richard's brain, which is fascinating. One more question for Dr. Reddy. Before his stroke, his artery was cleared out, and doctors inserted a stent. What was the purpose of the stent?
Yeah, the stents basically, what they do is if there's a blockage, it keeps the artery open and pushing the blockage away from the blood flow. It keeps the artery open, but if you again have the risk factors, including genetics and everything, the whole stent can also get close too. So we have to be, just because we have a stent doesn't mean that it's fixed. It is fixed for then, but then it can re-block again, it can have narrowing in the artery there, A. B is that you can have a blockage next to the stent. Stent is only very small, it's about a centimeter or 2 based on what size of stent we use. But we are not preventing a blockage beyond it or before it. So stent is not a fix for long term, it's just a fix for that narrowing at that time, and it may or may not last for long.
Dr. Abraham, you suggested we do this episode on Richard because when we talked on the phone, you said so many of your stroke patients have heart disease. Is it most of your stroke patients that have heart disease as well?
Yeah, I would say most. Most of the people that have these large clots in the brain, typically the clot comes from down here.
Wow. from heart disease. We want to show some images because in Richard's situation, a large blood clot traveled from his heart to his brain. So let's take a look at image number 1 here. What artery is this that we're looking at? It's right here.
So this white spot here is actually, this is the
Right
MRI,
there?
correct,
Okay.
yeah. This is the MRI that was done later in the day after we did the intervention, but that shows the only part of his brain that's stroked out, as opposed to if we had not opened it up, this whole wedge would be white, and that would indicate full stroke of that area.
So looking, wow, I saw your eyes open like saucers when you heard that. Yeah. Looking straight on it at someone, what part of the brain would this be in that we're looking at there?
Yeah, so this is on the left side. It's roughly right here, a couple centimeters into the brain is where that's at, yeah.
And that came from his heart.
Correct, yeah.
It's wild. Now, the removal of the clot is equally as fascinating because you enter the body through the groin.
Correct.
And you go all the way up from the groin, from Richard's groin to his brain.
Yeah.
That's wild. How long does that journey take?
It depends on everybody's anatomy. If it's very tortuous, it can take several minutes, but if it's fairly straightforward, then we can get up there within 1 to 2 minutes.
And we're looking at the process in an illustrated animation right
Correct,
now.
yeah. So that's showing that dark part is the clot in the same artery that Richard had in his brain, and then we take these catheters, these long tubes, and this is the one that we did for Richard, and we literally put it up to the face of the clot and apply aspiration or suction and pull it out.
Now, we do have a show and tell that Dr. Abraham brought for us because I love when doctors bring show and tell. Is this is the thing? I mean, not the exact one. This went up Richard's groin into his brain?
Correct.
Something
this
like
is
this?
the same model that we took into Richard's brain. It doesn't look big, but the opening of it is one of the larger interdiameter catheters that we have. So the bigger the opening on these catheters, the more clot we can pull out.
It's about like the size of where the tip of a pen would come out.
Roughly, yeah.
I don't know how well you can see that at home.
Yeah. And
Richard, what's it like to see this thing and know something like this?
It's pretty amazing because I'm assuming they use the same thing on my neck to go in and clean my neck out for the first time.
And how old were you when that happened?
I was, let's see, 41.
Okay, so
10
you had
years after my heart surgery.
31 was your first, 41 was your second. You thought you were out of the woods, and then.
Well, I didn't think that, but I knew I was having a
Do you wanna
history
feel
from my
this?
father, my grandfather.
Do you want to touch it? See?
And yeah, that's pretty small.
yeah.
That's pretty amazing.
But to the brain, it's a really big catheter.
Yeah. But my father and my grandfather both died at 47 years old.
So
My
young.
dad had a couple strokes at first, and they weren't really major. But the third time it was a major heart attack, and he just passed away. And my grandfather passed away from a heart attack. So when I hit 47, I was a little nervous.
Sure you were.
You know, but I had open heart surgery when I was 31. I caught it before I had a heart attack. I already knew I had the blockage, so I went in and had that taken care of. And then after that, 10 years later, I had my carotid artery done, and now this, you know. So it seems like every time I turn, about every 10 years or so, I'm in the hospital doing something.
Well, let's hope
you know. I'm hoping it's the last time. So I have a small one in my heart, but we're taking medication to dissolve that one. So
Okay, that's good.
yeah.
And how often do you take that medication? Is it a
Every
daily
day.
medication?
Every single day.
We have some more images to show. We want to show you what Richard's artery looked like before you did any intervention at all. Dr. Abraham, what are we looking at here?
Yeah, so the picture, we're seeing the carotid artery coming up, and you see as the artery is going to the right of the screen, it completely blocks off there. So that's where his clot was. And if you look on the opposite side, you see full flow to that side of the body.
Oh, so we're supposed to see a symmetrical image.
Symmetrical,
Okay.
yeah, but his is completely blocked there. So you can see the area of that where there's no blood flow is a big area of his brain. So that's where the blockage was, or the clot.
We have some video. Richard, did you want to say something?
No, not yet.
I think a pretty impressive blockage. I mean, it's very significant blockage. So.
Yeah, it looks more than what you would actually think it would look like, you know. But especially when the picture's blown up a little bit where you can actually see what it is.
How big was the blockage, if you hold up your pinky finger?
Smaller than this, it's about 3 to 4 millimeters. So
that's in your brain.
Yeah, in your brain, yeah.
And when I hear doctors say, yeah, that's significant, that means that you see these things every day.
Yeah.
Correct, yeah.
Wow, you're quite a guy. You went all out.
I just like to tell them I'm hard-headed, that's all. So,
Does your wife agree?
probably.
She's waving in the wings, nodding her head. Yes, yes. We also have video of you working the catheter inside the brain. We want to take that. This video is so cool. If you look off to the right of your screen, you can see like the little catheter wiggling in there.
Yeah, so there's a wire going, we go through the clot, we take the catheter, and you can see it coming around all the turns in the arteries to get up into the brain.
Dr. Abraham, how are you guiding that? Are you looking at a screen showing you, how does that work?
Yeah, so Richard's laying on the table, I'm next to him with these catheters, and I have a foot pedal that activates my X-ray machine so that I can see live the devices going through. So I'm just, with little movements with my fingers, just guiding the wires, guiding the catheters, making sure it goes to the clot, and making sure the wires don't go in the wrong direction.
Did you ever play the game Operation when you were little?
A little bit, yeah.
It strikes me as that, but the stakes are way higher.
Yeah, there's nobody zapping me if I make a mistake.
How long does it, I mean, you just have to sit with your fingers on this little wire and meticulously guide it through his brain.
Correct, yeah.
Well, I don't think people realize how thin your veins and stuff really are in your body. I mean, there's thousands of them.
Yeah.
You know, so when you go into a main artery like that, it's still not that big, you know.
Yeah.
But I mean, it's pretty amazing.
Unfortunately, you've become kind of a quasi-expert on this sort of thing.
For now.
We have a picture that shows your fully opened artery as well. We want to show that to our viewers now.
Wow.
Now that's what it's supposed to look like.
Yes. That's
How many
full flow out there, yeah.
How many passes did it take?
It took 2 passes. So once I was able to partially open it, and then I went a second time and then got the remainder of the clot out, which was a large clot. So.
And we have some pictures of that.
Yeah.
So let's take a look at the clot that was removed, and it's kind of broken up into pieces.
Correct, yeah. So you can see that one on the bottom is with the first pass, and then the majority or the meat of the clot was a top clot. So that was probably 2 to 3 centimeters in length, so very large.
Just like this, or
yeah,
that big.
roughly like that, or so.
2 to 3 centimeters.
Yeah.
So if we hold up a pen, the tip of this pen,
roughly the dark part, yeah.
or the first joint of a finger.
Yeah, that's a good analogy.
Was it about the width of a pen?
Not as big as that, because this is the catheter that it's taken in, so
Sucks
it's
it out.
roughly the width of this. Yeah.
How do you know you've got? Do you have to get every single little bit? Do you have to keep going until you see it totally clear?
Ideally, when we have those large proximal clots, we want to completely clear that. Sometimes as we're pulling it out, small pieces can break off and go to smaller arteries. And that can happen, but the farther out it goes in the smaller arteries, the less deficits people have, if any at all.
There's some more. Is that more of his clot? Just other pieces that came out?
Yeah, there's little pieces sometimes that break off, and we were able to pull different parts out.
Richard, is that the first time you're seeing this? What's it like
pretty
to
amazing.
look at it?
I mean, you would never think something like that would be in your body. Yeah.
Right.
You know.
And go from your heart.
You don't realize it until it happens to you. You know, I knew I was having a stroke because I've been through it with my brother, so I knew what the signs were. And I'm just glad somebody was there to help me.
One of your coworkers who knew the signs.
Yeah.
Called 911 right away.
Yeah.
We have some great questions coming in. If you have any questions or a comment that you'd like us to share on the show, you can send it to us right now on YouTube, Facebook, the All Things Heart email. You can find all those links right here on your screen, so you can connect with us in real time. And while we give our viewers some more time to submit their questions and comments, we want to share an MRI of Richard's brain, and we're going to pull that up in the monitor again. I want Dr. Abraham to show us again where this stroke happened, just so we have a good visual in when we're telling his story. Can we show that picture again? We'll give our tech team some time to do that. But basically, it was 2 centimeters in.
Yeah, on the
left side. So kind of right above his temple.
Yeah, right here you can see that. So fortunately, just that tiny area. Again, if we had not removed the clot, again, this whole area of the brain would be white and stroked out.
And then what happens to Richard if that happens?
So that would be what we call a malignant stroke, meaning because such a large area of the brain swells, because it can't swell out the skull. A lot of times people have to have the skull removed to allow the brain to swell. You would have, complete right-sided paralysis, unable to speak, things like that. So
and that's probably what happened to my brother.
Probably, yeah.
Yeah, because he was getting ready to go to work or something, and he didn't feel good that day before, and then that night he had his major stroke. And he couldn't talk, his brain didn't work right, his whole right side didn't work. None of that stuff. He couldn't spell, he couldn't do any of that stuff.
Wow.
And I took care of him from 2011 to 20, when he passed away in 20, so. But,
oh man, so you took
so
his
anybody that has a stroke, you think it's a joke, it ain't no joke. It can cause major damage.
Yeah.
Can you tell us the medications you're taking now to keep your blood pressure at bay and everything?
I couldn't tell you right offhand.
Too many?
I mean, I take a lot of pills, but they all seem to be working because I'm still standing. But I take a lot of blood pressure pills, heart pills, cholesterol pills. All that goes right along with it.
Well, it's working. You're still out doing things around the house. You're still Mr. Fix-It, Mr. Builder, Mr. Handyman, all that.
Got to stay busy.
That's right.
And I'm semi-retired, so. When I'm at home doing nothing, I got to do something because if I don't, you get bored and then you pass away.
Get busy living or get busy dying, like in Shawshank Redemption.
Yeah, pretty much.
That's what they said.
Yeah.
High blood pressure. I want to ask Dr. Reddy about high blood pressure. Is that also linked to cardiac issues, and how is it linked to cardiac issues?
Oh, absolutely. So when we talk about cardiac, we have to realize that it's cardiovascular system, so it's heart and blood vessels together. Blood flows to every part of the body, and blood vessels supply the blood to different areas. So if there is high blood pressure, that means there's more pressure in the arteries, and there are changes that happen in the vessels that can cause blockages, that can cause blood clots, that can cause, and when we talk about heart disease, the most common heart disease is blockages in the arteries of the heart. But you can have blockages in the arteries of the kidney arteries, brain arteries, stomach arteries, anywhere else. So it's actually a vascular disease that makes it more likely to have clogging of the arteries, buildup of cholesterol. It's actually a combination of high blood pressure, high cholesterol, and if you have diabetes, that accelerates it. So combination of all these things make plaques in the blood vessels in different parts of the body. Heart is the most common organ, but it can be in the brain, it can be, again, in the legs, anywhere else.
When it comes to cholesterol, the American Heart Association finds that 25% of American adults have high LDL. And that, as you're saying, increases your risk, 25%. So would Richard be a good candidate for something like a cardio score?
He probably already has a high score. He probably has a high score. Richard, like people at younger age, that's where the cardio score is the most important thing. So cardio score is basically what it means is that you're screening your heart to see if you have early stage of blockages developing.
We have some video of our boss getting a cardio score.
So
while you talk about that, we're going to look at Jill, who's such a good sport, got her hands over her head. She's going through the tube. What information are they looking for in the cardio score? Like, what are they seeing?
So they're looking, it's a very simple test. It's a CT scan, but it's a very low intensity CT scan. What you're looking for is there any calcium being built up in the arteries of the heart? That's basically what we're looking at. And if you do, and we compare it with age, controls of people at the same age, if they have that amount of calcium being built up. Now, if you have a 90-year-old person getting a cardio score, they will have calcium built up. But if you have a 30-year-old person having a calcium score which is positive, something is, we need to be more aggressive in controlling all the risk factors, the same risk factors I talk about. Genetics, we can't do anything about it, but blood pressure, cholesterol, diabetes, and then smoking if they smoke.
That's the only test you want to zero on.
Oh yeah, I get it done every often. So that's because of my family's.
Yeah.
I get it done every few years, cardio score. So
I got mine done a few years ago.
You did,
too, because I have a young family history of stroke or a heart attack as well.
Yeah.
So.
I actually have one scheduled for next month. I'm going to get a cardio score because Jill inspired us all to do that. I want to get to some questions from our viewers because we have some great questions. Jean submitted one by email. Jean wants to know, how common is it for a clot to travel all the way from the heart to the brain?
I would say it's about a quarter, if not more, of these strokes that we see.
So 25% of
25%, yeah.
those things those jelly blobs you remove came from the heart.
Yeah.
Where do the other ones come from?
If people have plaque in their carotid arteries,
Okay.
that's also another source where clot or plaque can break off, go into the brain.
And that's what you had cleaned out when
Yeah.
you were in your 40s, 41, did you say?
Yeah, I was 41 when that
Okay.
happened.
Becca has a question for Richard. She wants to know what changes has Richard made to his diet or his lifestyle?
I'll eat a lot more salad. I used to hate to eat salad. I never liked it, but here recently, I've been eating a lot more of it and trying to eat more greens and stuff like that, you know, and stay away from the red meat. I don't eat hardly any at all red meat. Once in a while, I might have a steak, but not very often, which is fine, you know, to have them once in a while, but not every day. Red meat is a killer.
Not every day.
That's the way I look at it.
Fast food.
I eat, no.
So, yeah.
I eat a lot of chicken, a lot of fish.
Mediterranean diet.
I like chicken. I love chicken.
You gotta love it now.
I do.
Doctors
I loved it before.
You're vigorously nodding your heads. Yes.
Yes.
Is he
Yeah,
on the
yeah.
right track
Oh,
as
yeah.
far as greens?
That healthy diet
Lean
is
meats.
But
crucial.
the thing about that is the damage has pretty much already been done. All I can do is kind of prolong my life by starting to eat the right things, you know, more often than what I did when I was a kid. I mean, when I was a kid, I had hamburgers, pizzas. I mean, I grew up in the 60s and the 70s, you know. So that's the way people ate back then, you know, bacon, hamburger, red meat, you know, whatever, something like that, pizzas.
I got to tell you, if you have a kid now, that's what kids eat now. I will make the best dinner, and my son will go off with his job money and come back with Chick-fil-A or fast food, and we have this whole meal right here. What are you doing? It's hard to get kids to eat healthy.
Well, I got a 31-year-old son. I try to get him to go to the doctor, and he's pretty hard-headed. But, I mean, I can't make him go, but I could definitely suggest it to him. And so if he goes or not, that's on him. But, you know, I ride him all the time about it. So
You described yourself as hard-headed at the beginning of the
I
program.
am hard-headed.
So do you see yourself in your son?
A little bit, yeah. Yeah, for sure.
You think you're getting through to him?
I'm working on it, you know. I'm going to get him there if I have to take him myself, but he's going to go.
If you have to put him in your wheelbarrow.
If he's 31, I said, you may be 31, but I'm still in control.
That's right.
You know, so.
You can show them some of the pictures of your closet.
Yeah, show
we should
that.
get
That'll
some
scare
printouts of
anybody.
that.
It's time for some final thoughts from our guests, and I would love to start with you, Richard, because you've made it your mission to get it through to the other men in your life. They need to pay attention to their
Yeah,
heart.
my brothers, especially my oldest brother, he still smokes and he drinks beer, and I'm like, you know, I can't tell him what to do in his own life, but I do. I'm constantly, you know, you guys are still smoking. I don't understand it. I never smoked. One of my younger brothers died from smoking because he had a stroke. Then he had COPD go right along with it, and then you know, you guys seen what happened to him, and you still do this. I don't understand that, you know. So it's pretty tough to watch, but I can't change them. They're going to do what they want to do.
What about
You
to
know,
the
they're
other
grown
men watching, people's husbands and brothers and dads?
Well, they should get to the doctors and get themselves checked out.
Yeah.
I mean, you know, I was a little hard-headed too. When I had my first heart attack, I didn't think, hell, I was playing softball on a couple teams, you know. I'm like, this thing gonna happen to me. It did. And it just happened right out of the blue. You know, I wasn't ready for it. It just happened. When I was playing softball, I felt like somebody was stabbing me with like a little pin or something, you know, and I thought, I just pulled a muscle, you know. So I went to the doctor to see what happened, and now it is actually 95% blocked artery. So
Oh my gosh.
I went in 2 days later and got it fixed, had a single bypass.
You finished the game.
Well, I'm working on finishing
I mean,
the game.
you finished that game
no.
in the middle of all this?
No,
Or did you?
because I went to field the ball and it hit me in the tip of my finger. Well, it started bleeding. I about passed. They say I turned as white as a ghost on that field. They said I had to go sit down on the bench. And then 2 days later, I went to the doctor, and that's what happened.
Wow.
So I was not really having a heart attack, but I was on the very close urge of it, having one.
Wow.
So I went in and had a single bypass
And that's-
before I did have a heart attack. You know, but it did, I got a little damage to the lower part of my heart, which I knew, you know, was there, so. But, yeah.
Listen to Richard.
It is no
everybody.
joke. It's
Yeah.
no joke.
No joke.
If you think you got something, you better go get it checked out.
Dr. Abraham, anything you want to add? And is this the first time you guys have seen each other since you pulled the clot from his brain?
We saw in clinic though, right? I thought.
Well,
afterwards.
we did see once in clinic, yeah.
Okay. Yeah, and then since then, yeah. But just like Richard's doing, being proactive is crucial. Having that primary care physician. My wife's an internist, so she's the one who's always like, somebody, you have to have that primary care to, do those routine adult health maintenance things. And then that's proactive, and then also, eating healthy, not smoking, all those things are important.
Yeah, I never smoked, so that's one thing I did have on my side. But, it was hereditary through my family. My father had it, my grandfather, and they all smoked. And if you think that smoking won't pass through you, it will. It does. Mm-hmm. It definitely will.
Dr. Reddy?
So, yeah, I mentioned about the 5 risk factors. It's not additive, they multiply. So if you have all of those risk factors and you do something more like smoking, it just multiplies the risk. Mm-hmm. So we want to make sure that, if someone who's like having a family history, be very, very careful about modifying those risk factors. Mm-hmm. Not smoking, probably the best thing you can do for your health. And then obviously the threshold to treat for each of the risk factors are dependent upon the score, your score. If your score is high, that means you have to be much more aggressive in treating these risk factors. So the cholesterol cutoff for a healthy person is different than someone who has a heart disease. So we get more aggressive in trying to treat.
Thank you so much, doctors, for taking the time to join us today. And Richard, thank you for sharing your journey. And you came here in the freezing cold. It's one of the coldest days of the year, if not the, so thank you.
I'm an ex-truck driver, so I'm working all sorts of weather, so.
Nothing's stopping Richard.
But it's nice to have an indoor job now, though, I'm telling you that.
I bet it is. Thank you, Richard, for sharing your journey. And thank you for watching and joining the conversation. If you'd like to watch or share any one of our previous episodes, just scan the QR code on your screen right now. That will take you to a list of all our previous shows. Also, February is National Heart Month. How is your own heart health? We've talked about it all morning. The QR code on your screen will take you to a heart health quiz so you can assess your own heart health. Coming up next week on All Things Heart, the patient who has the most infectious giggle you will ever hear. She's amazing. You're going to fall in love with her. Finding joy among the challenges. On the next All Things Heart, meet a former pediatric patient who transitioned to adult care and the program right here at the health system that makes that transition seamless. That's Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. After living most his life with an incurable disease, Jeff Laudermilk was amazed to find an organ donor already in his life. I'm Jessica Lovell on the next Morning Medical Update. The remarkable gift and expert care giving Jeff hope for the future. Friday at 8.